It is patients with Paz disease are usually asymptomatic, and they're usually detected accidentally, either by a radiologist or by a laboratory test, the elevation of their serum alkaline phosphatase. When Paz disease is symptomatic, bone pain is the reason that most bring them to our medical attention. The alkaline phosphatase is elevated due to increased bone formation. We will talk about the three different phases, clinical phases that we see Paz disease in. And in both the mixed phase and in the later blastic phase, the turnover of the bone formation is more common, and that's when you'll see elevated alkaline phosphatase. In addition, both the serum and the urinary hydroxyproline are elevated in Paz disease. And this is especially so in the early lytic phase of Paget's, and that's because of increased bone resorption. So why do patients with Paz disease have pain? It could be from the lesion itself having perhaps increased blood flow. It could be a secondary arthritis from the deformity we see in the joint in these patients. It could be from a nerve compression because of the increased bone formation and any of the channels in the bones, the neuroforamina, the nerves are traveling through. If they are compressed by the new bone, obviously that can cause pain. The dreaded complication of a sarcoma, which can happen in Paz disease, can be painful. And finally, we just talked about the increased vascularization may be a problem. In fact, patients can get CHF from Paget's, congestive heart failure. So of the different bones in the body that can experience Paz disease, the most common four are the pelvis, the vertebra, the lower extremity bones. So for example, the femur is most common, and the skull. And these are the big four. These are where we usually see Paz disease. Now, it can exist in fact, in any bone. In fact, in America, we have a board examination, the oral board examination to become a radiologist. And one of the favorite board cases, and it was shown this year, in fact, is Paz disease in the patella. So obviously, it's commonly seen, and it can be seen in any bone.